My name is Michael Betel, and I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, in part 9 of our 10-part series, we'll be discussing a really important topic for MASLD and MASH patients: how to advocate for yourself in the healthcare system. Our expert today is a hepatologist from Mississauga, Ontario, Canada, Dr. Supriya Joshi. Dr. Joshi is the chair of the Fatty Liver Alliance Medical Advisory Committee. I'm very proud that she is. And she's on our board of directors and is incredibly popular on Instagram with almost, and I looked today, 115,000 at Liver Health MD followers. 115,000. Supriya, you are a liver patient influencer and the perfect expert to help patients prepare for their doctor visits, asking the right questions, ensuring their concerns are being heard. How can we empower patients to take an active role in their own healthcare and feel confident and supported at every interaction?
I
It's
think
a
this
big
is,
question.
yeah, amazing question. Thank you for inviting me on, Mike, to help you with this platform. So the goal here is to really empower the patients, all patients, not just liver patients. And after being in practice for 20 years, you realize who is more versed in their healthcare versus those who aren't. And you can almost relate that to outcomes. And I'm sure data does support that those who know more about their health will likely have better outcomes down the road. So the first thing is, I think I would encourage all people to know what their medical health issues are, and keep a compiled list so that it's always there. What surgeries have they had? What medical problems have they had? What current medications are they on? And if they've been tried on other medications, what were they? And did they work or not work? So whenever you're referred to any type of doctor, you have that album and that memory and collection of all that very relevant information that is completely personalized to this individual. So I think it's really important for people to understand their own health journey thus far. So now they're having a current problem and their primary care provider has made a decision to refer this person on to some other specialist for care, perhaps. And if that's going to happen, I would again encourage the patient to know who they're being referred to and for what problem. And I say this because many times I've invited someone into my office and they go, "Who are you? And why am I here to see you?" "Oh, I had no idea I had this problem."
Yeah.
So we're already at the doorway, we're not connecting because they don't even know why they're there to begin with. They just went where they were told to go. So know your healthcare issues, your journey, know why your doctor is referring you to see somebody so that you can be prepared for that appointment. So when it comes to that preparedness, it means understanding what are your personal issues or struggles with the problem their doctor is referring you for. And have you seen anyone else for that same issue? So again, come with a collection of what you know about your health, because I find even though family doctors and they refer onwards, they don't realize that patient may have gone elsewhere for care, or they probably do know that, but nobody has all the collected information. So the only person that knows everything is the patient. So
They're their
again,
best advocate, right?
that's being their
Yeah.
best advocate.
Yeah.
So now when you go to that specialist visit, to answer your question, how do you become most prepared? Not only to know your history, know what symptoms you're having, know what you've tried to resolve your issue, what do you think is going on, and try to allow that conversation to happen. And I know that's not always easy because, as you've already said, sometimes the doctors can be too busy or they give off that impression they're too busy and they're not engaging with the patient. And that's certainly a flaw of the medical system that we have. But I think if a patient is not understanding or not feeling they're connecting to that doctor, they repeat their question, they repeat their concern, and make sure that they're heard. Hopefully, the doctor then responds to their question to give them an answer. And just like I tell my children when they're in their classroom, if you don't understand, don't leave yet. Ask again so that you understand what the problem is, what needs to be done for the next level of testing.
Yeah.
And
I was going to say it is intimidating. I know you go to your own doctor, I'm sure, for different things. So it's right, you're not just a physician, you're a patient also. And so when you go to a physician's office, and they have a whole room full of patients waiting, it's a lot of pressure for a patient sometimes to get the courage to ask what they really want to ask, and getting that feeling the doctor is going to be upset with them, or whatever. Is that what you experience, either as a patient or as a physician from the other side?
Um, I think it comes down to what a person's, I don't want to say what mood is, but what angle they're coming from. Because some patients come from a very frustrated side of
Yeah,
healthcare.
medical
Things
side.
haven't been
Yeah.
going well for them or their healthcare loved or their loved ones. Versus other people are just new to the healthcare system. They've never had a problem. This is all new to them. And this is where, metabolic liver disease is one of those very common silent conditions. So many people didn't even know they had it when they're referred to someone like myself.
Right.
It never registered to them because I never complained about anything. So when it comes to me being a liver specialist and people coming to see me, they most often either don't know why they're coming and it doesn't phase them at all, or they're terrified and think they have liver cirrhosis, which is the word they've heard when it comes to liver disease. And they think they're coming to my office for me to give them a date on when they're going to die and leave the world.
Oh my God. Okay.
Yeah, so it's
Yeah.
it's it's so polarized with how the visit goes. So I know when I see someone in a follow-up, one of the first things I'll tell them, if I already know it's good news, I'll say, everything looks good. And then I'll
Before you
bring them in
start.
the room. And I find that little bit of engagement and reassurance to be very calming. Then they can sit in the chair, then they can listen without just, perseverating on what negative thing I'm going to tell them about their life or their health.
You said something also really relevant in that this particular disease, we say the spectrum from MASLD to MASH, is really multi-organ metabolic disorder. And so type 2 diabetes is very common. The struggle with obesity is very common. They probably have sleep apnea. They may have cardiovascular issues. They could have kidney issues. And so you're right in what you said. They may be coming to you from a different door and not know why they're being referred to you. And what you said too about making sure they have their whole medical history would really help, right? Because you may not be aware even of some of the other metabolic issues that they have dealt with in the past, or their family maybe.
Absolutely. And most people don't really realize the high degree of interconnectedness of the other metabolic diseases to the liver. And most people are shocked when I say, your liver disease probably came first. You had it for all these years and it just wasn't noticed.
And what about the family side of it? When patients are coming to you, uh, from what you experience, do you recommend that they bring someone from their family with them, or a spouse, or parent, or caregiver with them?
I always try to because I find the person can be very anxious and not necessarily really hear what I'm saying to them. Even if the diagnosis is not a scary diagnosis, is that, yes, you have abnormal liver enzymes, very mild fatty liver disease, no fibrosis. They may still not really be hearing me about the diagnosis, but then they may not also be hearing me what I'm advising them on how to reverse this, which is the most of our conversation in the office. So they have a second person in the room. It's always great to have a second, set of ears to hear and question and make sure that it's understood what the plan is. But I also find when it comes to providing lifestyle recommendations, if the patient is not the one who knows how to cook food or does the food preparation, any advice I give them on ideas and tips on meal preparation is just going to go in one ear out the other. So I always like to say, bring someone who's involved with the grocery shopping, the meal planning, because that's the main person that's going to help them with all of their metabolic diseases.
And I appreciate that a lot. And I'm thinking too that this is a really tailored care approach. So that means that every patient that's coming to see you is not going to get the same answer from you, because you're going to use their background and their medical history to make suggestions to them. So do you find that patients talk about how different they are, or maybe even someone in their family who's had a different journey? You know, Did I ask that right way?
Not sure. Try to ask you one more time.
What I'm trying to say is, do you think that patients are coming to you from a different perspective than even people in their own family and the way they're asking questions, or should they ask questions in a different way because it's about them and their journey?
Absolutely, because I do find some people are just ambivalent about their health issues. They're here to enjoy their life, and whatever I say doesn't really matter. So there's that category of person. That's their, their the way they live their life. That's their, how they continue on. Whereas others are very much aware and want to do everything they can to pivot and change and reverse it. And they're almost insulted that they have a label for a medical condition because they thought they were doing a really good job, but just needed to have a better understanding on what course they can take. So I
Okay.
think where they come from and their perspective on life, because everyone has that different philosophy.
By the way, are you still using to describe MASLD and MASH? Are you using you have fat in your liver, you have fatty liver? I do remember that you and I had a discussion about probably 2 years ago where you told people if they needed to lose weight that they should not worry about losing weight like standing on a scale kind of weight. They should work on losing weight around their liver, fat basically around the liver. Do you still go by that?
I do. Well, it's more about the visceral adiposity, right? I
Yeah.
think people understand that. And the number on the scale may not change if they're doing a combination of exercise and starting to build muscle. I mean, their waist circumference will go down. And as the waist circumference down, the liver fat is going down as well. That's the cardiometabolic risk factor for where that fat is. But their number on the scale may not change.
Well, and so the same point around, I know it's not the topic today necessarily, but BMI is not the best measure, right? If somebody goes to the gym all the time and they're very muscular, their BMI is going to be higher than would look like if you were looking at just fat, right?
Correct.
Yeah. Do you have any other recommendations that you can think of that we could share with people that are coming to see their doctor? Let's say for the first one, it's the first time they're going to see the doctor, and you've shared that they should come with their medical history. Any other like key questions that patients have asked you that you go, oh my God, that was a really important question.
Well, I love it when patients actually ask for copies of their, fiber scan
Oh,
report
that's a
or
good one. Yeah.
they keep track of their lab work. I think that's fantastic because why shouldn't they know? They see the exact copy. I think it helps them. I mean, I think I always tell them with a grain of salt, they don't read every word because every word could be scary, like an MRI report or a CT report, because they're not going to understand that medical lingo. But I think for people that are being followed serially, I think it's useful for them to see it because I think it gives them the opportunity to own it.
Mhm.
And then it allows them to be really an active part of their healthcare. So I love that various labs now can allow people to have a portal into the system. They can keep track of their liver enzymes and all blood results or imaging results. I think that's terrific because I think that really engages the person to be involved, which is what I want, what we want.
Okay, I have one more question for you. If a patient comes into you and maybe they've been told by previous physicians that to address their mast cell mash, they just need to exercise more, eat less, and you'll be fine. So let's say they've tried that for the last 20 years and they've been unsuccessful. What other recommendations would you have? Maybe in particular, like what should the patient say to the doctor if they do hear that? Because obviously there's a lot of people watching this where you're not their physician. So if their doctor says to them a really quick, easy, let's get this patient out of the office kind of response, go exercise more, diet. We'll see you again in 6 months. What do you say? Or what should they ask?
If it's not working,
Yeah,
well,
they've
what are
tried
all
it.
the
They've
options?
tried it and tried it and tried it,
Yeah,
and it's
well,
like,
they should be well aware of their options. So I think we don't give enough credit to bariatric surgery. So I think that's one option they can discuss, with your physician. If that's not something they want to pursue, then considering joining a program, talking to a trainer, a dietitian, be part of a holistic program that will get them through that and give them the engagement, the feedback. Some people need more micromanaging and they work well with that. And if that's not working, I mean, they're doing it, they're getting stronger, they're being more cardiovascular fit, but they're not losing the weight that they want. Well, now we're in a lovely era where we have pharmacotherapy,
yeah, true.
you know? And I think what I don't want happening is just prescribing pharmacotherapy without trying to correct the lifestyle, because they really do get partnered together to give that individual the maximal success. And this is not just for today. We have to always think about, what are the decades ahead going to look like? And you don't want, I always joke, the weight loss drugs will cause muscle loss. Any weight loss system will, if you're not exercising to maintain that muscle mass. So you don't want to be this skinny, frail person who can't move, when you're 60 or 70. So I think people have to educate ourselves and educate our patients. This discussion is not just about today. It's about where your life is going to be in 10, 20 years. And we're playing that game now. And so it's important to have that view in the long game about how you want to be. Ideally, if you could, what changes today will be impactful for that to get you where you want to be at that time. So if weight loss is the goal, you got to still optimize nutrition. You still have to optimize your strength and your cardiovascular fitness to the best that you can do. But then we've got, GLP-1 analogs, we've got tirzepatide. There's drugs that are definitely available to allow weight loss, optimizing excellent glycemic control, can, optimize heart failure symptoms in people. And now, as we know, can reverse, stage 2 and 3 fibrosis in our MASH patients. So it's super exciting time to treat our patients.
Thank you. You are, like I said to start with, an amazing patient advocate, and your Instagram profile really says it all too, because I am so impressed with what you do and the advice that you give. I think you sort of combined a lot of those smaller talks that you've done into this talk today. So on behalf of patients that are watching this, thank you for your advice, and I'm sure you're going to help a lot of people.
Well, I think you're helping a lot of people. Thank you so much, Mike, for everything you've done. Thank you so much.